In this video, I'm explaining what is capitation payment in health insurance. And so here we have a doctor, and the question is, how does the insurer pay the doctor? How much money? And in this case, the doctor comes up with a roster of patients that this doctor is responsible for treating anytime they come into the doctor's office. Now, what this means is these patients aren't actually coming in. It's just that these patients are on this doctor's roster. And this doctor is obligated to treat any of these patients with whatever they need whenever they come in the door. So the doctor submits the roster to the insurance company, and the insurance company has a certain payment per patient. So the insurer will say, okay, it looks like you have 500 patients on your roster. We pay you $400 per patient, so we'll pay you, my apologies, I had the comma incorrectly. So the insurer in this case is going to pay the doctor $200,000 for taking care of this 500 patient group of people. And that's just 500 times 400. So it's a little bit of an odd system because if none of these patients ever need care, if they're actually so healthy that they just don't need to go to the doctor very often, then this doctor doesn't have to spend very much. This doctor just sort of sits in their office, waits for anyone to come in the door, and nobody comes in, but they still make the $200. So the $200 is not at all connected to how much care this doctor gives the patient. It's not connected to how long the doctor spends with the patient, or how many surgeries the doctor does, or how many diagnostic techniques the doctor uses on the patients. The doctor gets this amount no matter what, just based on their roster. Now, this is a system that's used in the United Kingdom for their doctors, where the doctors have this list of patients. And one advantage of this kind of system is that if the doctor can give good preventative care and good sort of medical education and stay healthy types of education, if the doctor can do great things to this population such that they don't need to come in as often to get surgeries and to get these expensive things, then the doctor gets to keep that money. Because the doctor has to pay out of pocket, out of this $200,000, for any diagnostic equipment, for any perhaps staff that works for the doctor. All of that has to come out of this money that the doctor gets from the insurer. So there's an incentive to keep your population healthy so that they don't come in as often, and that money that you would have spent on their surgeries, the doctor gets to keep. That's the advantage of capitation payments. Now, the disadvantage is a pretty big one, which is if the doctor can go out and recruit really healthy patients who are not likely to need surgery, then that's also financially advantageous to the doctor. So there is a strong incentive here to seek out healthy patients, and perhaps even more so to avoid really sick patients. Like if someone comes in the door and they seem like, based on their characteristics, their diagnoses, their personality, they're going to be coming in to get a visit every week, and they're going to need a lot of surgeries, and they're just going to be a very expensive patient to have on the roster. There's an incentive to channel that patient to a different doctor. There's an incentive to not take on that patient if you can at all avoid it. Now, of course, the law can, of course, require that you take any patient who comes in the door. So if you want to avoid those really sick patients that are going to be really expensive and take a lot of money out of your pocket, you might just be rude to them or just not have very good diabetes care since diabetes is really expensive. So that's the problem with capitation payments, is that the list of patients who end up on your roster has a big effect on how much you end up getting paid, where how much you get paid is basically the costs to the insurer minus the expenses of treating those patients. Now, I've oversimplified here, obviously, so it's not just cost per patient. This dollar amount is going to be adjusted based on age, based on whether or not they have diabetes. So the insurance company can adjust the payment based on the personal characteristics of the person. But the problem is sometimes the doctor knows extra things about who's likely to need more care that don't show up on the patient's age, demographic characteristics, and chronic illnesses. There might be other information that might cause that doctor to want the patient or not want the patient based on their health status. So capitation payments, it's not a perfect system, but it does incentivize preventative care. It does incentivize sort of a positive, stay healthy approach to being a doctor, which some people really like.